Can you imagine a single herb that acts as a powerful antioxidant, reduces your cholesterol, lowers your blood pressure, and helps manage diabetes all at the exact same time? This is not a hypothetical miracle of modern science, but a reality found in the bark of a tree known in ancient Sanskrit as Rudrogavari, or the literal enemy of heart disease. For those of you who feel frustrated by the complexity of modern cardiac care, or feel like you are just managing symptoms rather than strengthening your body, the story of Terminalia Arjuna offers a different perspective. Known as the warrior tree, it has been used for over 3,000 years to provide the heart with the strength of a legendary hero. Today, we are going to look past the myths and dive into the clinical science of why this ancient bark is considered the primary Ayurvedic defense against the world's leading cause of mortality. To understand why this plant is so effective, we have to look at its internal chemistry, specifically a compound your doctor may have already recommended, coenzyme Q10. While modern medicine has only recently embraced CoQ10 for its ability to protect the heart, the Arjuna tree has been naturally concentrating this enzyme, along with unique tannins and flavonoids, in its bark for millennia. This chemical profile is what makes it a true cardiotonic, meaning it doesn't just mask a problem, it actually strengthens the cardiac muscles and improves the heart's pumping efficiency. If you are struggling with high LDL cholesterol, Arjuna works as an antioxidant to decrease those levels, preventing the oxidation of fats that leads to arterial plaque. But the benefits of this warrior tree extend far beyond the circulatory system. In a surprising twist of natural synergy, Arjuna is one of nature's most significant sources of organic calcium. Since the 10th century, healers have used this bark to help knit broken bones back together and treat osteoporosis. For those experiencing the fatigue that often comes with aging, a decoction of this bark provides a restorative effect that Ayurvedic practitioners call shramahara, or the reliever of tiredness. It even plays a role in metabolic health, particularly for those with type 2 diabetes who experience the frustrating numbness of peripheral neuritis. You might be wondering why, if this herb is so powerful, it isn't in every medicine cabinet. The secret lies in the preparation, because the way you consume Arjuna determines how much of those vital compounds actually reach your bloodstream. Many people simply take a powder with water and find it difficult to digest, or they struggle with a fine silt that clogs their filters. To unlock the full potential of the bark, we use a traditional method called Kshirapaka, or a milk decoction. This isn't just about tradition, it is about biosynergy. Many of the most important phytochemicals in Arjuna are fat-soluble, meaning they need the lipids in milk to be properly absorbed by your body. To prepare this heart tonic at home, you start with 10 grams of coarse Arjuna bark powder. You combine this with 80 milliliters of milk and 320 milliliters of water. As you boil this mixture over a mild heat, the water slowly evaporates, leaving behind a concentrated milk infused with both the water-soluble and fat-soluble nutrients of the tree. Once the liquid has reduced back to the original 80 milliliters of milk, you filter it through a clean cloth. If you find that fine powder is still clogging your cloth, a professional tip is to use a French press or a very fine stainless steel mesh to ensure a smooth texture. This preparation should be consumed in small doses of 10 to 20 milliliters twice a day before your meals. While we talk about the heart and bones, there is a hidden benefit to this tree that almost no one mentions. It is an incredible treatment for your hair. If you take mature, green Arjuna leaves and soak them in water, you can macerate them by hand to create a mucilaginous, soapy mix. Using this as a natural shampoo for just 10 minutes before rinsing can dramatically improve the shine and quality of your hair, proving that this warrior tree cares for the body inside and out. However, because this herb is so effective at altering your internal chemistry, you must approach it with respect and caution. Because Arjuna naturally lowers blood pressure and blood sugar, it can lead to an accidental overdose if you are already taking allopathic medications for these conditions. If you are taking modern medicine, the best practice is to take your prescribed tablets first, wait at least 30 minutes, and then consume your Ayurvedic preparation, always under the supervision of a healthcare provider. For most people, a 3-month course is the standard window to see significant improvements in heart strength and cholesterol levels before taking a break. Ultimately, Terminalia Arjuna represents a bridge between ancient wisdom and modern biohacking. It offers a way to not just survive heart concerns, but to actively fortify the very muscle that keeps you alive. Whether you are using the bark to wash your arteries or the leaves to brighten your hair, you are tapping into a legendary lineage of healing that has stood the test of time. By understanding the science of biosynergy and the correct methods of preparation, you can transform a simple piece of tree bark into your most potent ally in the quest for lasting health. Support this knowledge, like, share with your loved ones, comment yes if you learned something new, and follow for more.